Couple months ago, I had a patient come in to me. Her name was Sarah. She was dealing, and maybe you guys can relate with this. She was dealing with fatigue, hair loss, brain fog. She was a little constipated. She was cold all the time, and she wanted to see what was going on. So she went to her primary care doctor, and primary care doctor ordered a lab test called the TSH, and the TSH was identified as being high, meaning that she had hypothyroidism, and the primary care doctor prescribed T4, also known as levothyroxine. She took that for a couple months and she was extremely hopeful. She was like, oh, someone found out the cause of this. All I have to do is take this levothyroxine pill and I'm going to feel great. I'm going to feel energetic. I'm not going to have this brain fog anymore. I'm going to actually start losing the weight that I have been gaining. And in her case, she wasn't able to get any benefits at all. She was like taking this thyroid hormone, but nothing was happening. So she then was like, okay, maybe something else is going on. I'm going to see another doctor. So she came into my office, set up an appointment, and I was able to see, okay, let's take a look at more than just the TSH. Let's see if there's something going on with T4, T3. So I ordered her T4 and T3, and what I identified is she was actually not converting her T4 to T3 effectively. She had a conversion syndrome. So the T4 levothyroxine isn't really going to do anything because it's not converting in her body to T3 effectively. So what I was able to do is actually prescribe her T3, and then after giving her the T3, she was actually able to get the benefits that she wanted. She was able to have more energy, think more clearly, start losing weight. She wasn't cold all the time, and she started feeling great. So if this is the big reason why, you need to learn about T3 and T4 and what the differences are. And we're going to talk about that in this episode. I'm Dr. Jake. I'm a naturopathic medical doctor and integrative physician. And on this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgery. Today, I'm going to talk about the differences between T3 and T4 on your laboratory tests. So let's talk about T3 and T4. First, I want us to talk about what is T4, because T4 is made and then it gets made into what's called T3. So you also have a little messenger that's made from your pituitary gland. It's called TSH. So a little message is sent from your pituitary gland, thyroid stimulating hormone. It goes and tells your thyroid gland to make T4. So that's what T4 is. It goes into the cells then and has some mild stimulation of the mitochondria in your cell to get all your cells working and doing what they're supposed to do. So that's what T4 is. It's mostly made by the thyroid, but it's not really the active form of thyroid hormone. The active form of thyroid hormone is T3, and T4 has to be converted into T3. And there's a lot of people that don't have good conversion of T4 to T3, and that's called conversion syndrome with the thyroid gland. So you might go into a doctor and they might order a TSH, which is the most common test for thyroid hormone. And your TSH might be normal, and the doctor's going to say your thyroid's normal. And you're going to be like, but I have all the symptoms and I feel horrible, but I guess my thyroid's okay, it's something else. But it really could still be your thyroid because they're not checking T4 and they're not checking T3. You might go to the doctor and they order TSH and a T4, but if they don't check T3, they're missing a piece too, because you might have a normal TSH and a normal T4, but your T3 is not actually working, and that's what's actually active. That's what's going to have the most stimulation on your cells to make the mitochondria work. So a lot of doctors, conventional docs, they don't usually order a T3. I don't know isn't necessarily why they don't, but they're missing a lot of diagnosis of hypothyroidism, or like what I like to call it conversion syndrome when this is done. What are the healthy levels according to your blood work with T4 and T3? And really, my most important thing is I like to actually look at numbers that are free T4 and free T3. So let's go back a little bit. So what is T4 and T3? T4 and T3 on your lab test, that is checking your total T4 and T3. That's protein bound. That's not what is actually available for your cells to take up. So what I actually want to look at, what is actually functional, not what's protein bound. I almost never check a T4 or T3. I'm always checking a free T4, free T3, because that's the bioavailable form of thyroid hormone that's not protein bound at all, and it's going to have the functional thyroid effect that we want. So a healthy level of free T4 is at 3 or 3.2. It could be a little higher than that, but that's a good healthy range. If you're below 3, I'm thinking that there's likely some type of issue going on. And that's for T3. We want it to be at 3. But with free T4, we want your level to be about around 1.2 or 1.4. It could be a little higher than that, and that's healthy. But if it's below that, I'm starting to think there's maybe an issue going on when I take a look at that. But obviously, you need to go to a doctor that understands all the nuances there. It's not perfect to be like, oh, I just have free T4. That's a little low. That means I need thyroid hormone. We're looking through the balance of the free T4 and the free T3 to really know if there's something going on with your thyroid gland. What are the issues or symptoms that you present with when you have, let's say, low T4 or low T3? Or high T4 or T3 for that matter. So the symptoms are quite different when you have high or low. But the interesting thing is you're going to feel exactly the same if you have low T4 or low T3. Both of them are going to decrease stimulation of your cells to and making your mitochondria not work very well. So that's what's really what thyroid hormone does. It sends a message inside your cell, tells the mitochondria to turn on, and that's why it gives you energy, focus, concentration, all the good stuff that you want from your thyroid gland. And when your thyroid's not functioning well, that's why you experience brain fog, fatigue, hair start falling out, you get cold because your cells are just not working how they should, and then you present with those symptoms. But long story short, if you have low T4 or low T3, same symptom picture, but what it does is affects how we treat it though. We need to treat T4 effectively, we need to treat T3 effectively. So let's say you get levothyroxine, which is the most common prescription given by conventional allopathic doctors, and you have a conversion issue of converting T4 to T3. Guess what? You're not going to get a lot of benefit from that T4. You might get a little benefit, but you're like, I've been taking this T4 and I just have to keep on taking more, or you don't really feel any difference. You're like, I'm just taking this because my doctor says I'm low in thyroid, so I need to take it because you're not converting your T4 to T3. So, or vice versa, let's say you are taking T3, but your T4 is low. You're also not going to get the benefit you need, even though in that case, majority of people feel a lot better because like we talked about, T3 is actually the active form. So you're actually getting the active form in there, but many people will feel a lot better if their T4 is balanced out if it's low. But you're not going to notice as big of a difference there as with levothyroxine with T4. It's not converted into T3. You don't have the active component, so you're not going to get really the benefits. But if you take T3, you do get a lot of benefits, probably not as good as you should if your T4 is low and you need to take T3. There's certain times that patients need to take T4 and T3, and that is very common. That's probably what I usually prescribe for my patients is they're taking both T4 and T3 because most of the time people have low T4 and low T3. Now, that's not always the case, but that's what I usually see in my patient demographic. And they T4 and T3 play well off of each other. So I don't usually prescribe one or the other long term for long periods of time. Now, I do prescribe, let's say someone's taking levothyroxine and they're converting their T3 just fine. There's no reason to do that, but it's very common that someone's taking T4 and not converting that T3 very well. There are some aspect times when I am prescribing just T3 in certain patient demographics because I'm trying to increase sensitivity of their cells to T3. That's another issue that could go along with people. And maybe we could set up a different discussion on that to really dive into thyroid desensitization of your cells. But then we prescribe high doses of T3 for that. But long story short, most of my patients, I prescribe T4 and T3. Now let's talk about if you're making too much T4 or too much T3. So if your numbers are too high on T4, you're going to be more hyperthyroid. And what that leads to is agitation, insomnia, heart racing, palpitations, anxiety. You just feel way too jazzed up on caffeine. That's what it is. Your hands can start to shake. That is when you have both too much of T4 or T3. You will experience these type of symptoms. The most common thing is people are making too much T4 compared to T3. And if someone's making too much T3, they're going to have hyperthyroid symptoms. But someone has way too much T4 and their T3 is low, they're not going to have hyperthyroid. So it's a reasonable question. I think, yeah, so I could talk about that, but it's completely opposite symptoms in that. Let's talk about what I do for someone that has too high of T3. First, I want to start out that is extremely uncommon that someone would have high T3 and not high T4. Usually it comes together, high T4 and high T3. Can I say I've ever seen it in my practice that someone has high T3 and not high T4? I haven't. But could it happen? Yeah. The symptoms that they would present with is hyperthyroid symptoms and the same symptoms we just talked about: irritability, anxiety, can't sleep, jittery, overstimulated, heart racing, etc. Those are the symptoms that they would present with. And then we would have to address the hypothyroid symptoms, and we do a lot of different things to help with that. You could prescribe certain medications to suppress the thyroid production. You could also give certain herbs to suppress the thyroid production. Many times it's related to an autoimmune condition called Graves' disease. So we have to go after the autoimmune component, which can be very detailed. And if you watch any of our other videos, we talk a lot about what we do for autoimmune disease, but that's for another day. If you want to get a hold of my office, visit my website, integrativemedica.com. Find my phone number there, give it a call, talk to my receptionist, and you can set up an appointment with me. You can do that virtually or in person. We also have a way for you just to set up the appointment on directly from the website. If you want to learn more solutions to treat T3 and T4 issues, click my video to the right. I'm Dr. Jake, and I'll see you there.